Good morning and welcome to your Farm and Home Show. I'm Kristi Shive, and this morning we're visiting with Dr. Alex Elswick. He's an assistant extension professor for substance use prevention and recovery. Good morning, Alex.
Good morning.
Well, Alex, September is National Recovery Month, and you've done a phenomenal job at educating and shifting the stigma on addiction and recovery. But what is the significance of National Recovery Month?
Yeah, it's pretty cool that National Recovery Month is the month of September. I think it makes sense in a lot of ways because August 31st is International Overdose Awareness Day. And it's a day we observe to memorialize the lives of people we've lost to drug and alcohol overdose. Just an opportunity to pay our respects. So it's always important that we remember the tragedy that exists in addiction, but also the hope that exists in addiction. That's what Recovery Month is all about, the fact that there are 25 million Americans who are addicted right now, but there are just as many who are in recovery. So we like to say addiction is a good prognosis disorder, and National Recovery Month is an opportunity to celebrate recovery and to recover out loud and really to reduce stigma.
And really to remind everyone that recovery is possible. Now, Alex, we mentioned the term stigma. What is stigma and how does it affect people with substance use disorders?
That's a great question. So stigma is sort of a mark of disgrace that's associated with a particular condition or circumstance. Research has shown that substance use disorder or drug addiction is the most stigmatized condition on the planet, that more stigmatized than any mental health condition, anything else there is. And it's in order to understand what stigma is, it's kind of helpful to think about the etymology of the word. So the word stigma comes from the Latin stigum, which comes from a Greek word that means tattoo or brand. So way back in the day, sometimes in those societies, they would physically tattoo or brand people who were slaves or people who committed crimes as a way to identify them as people who should be disgraced. And so today, certainly stigma isn't that physical scarlet letter, but it's a little more invisible, but it's no less harmful. So the stigma around substance use disorder basically silences people. It makes people feel as though that they can't reach out for help. Their family members can't reach out for help. Stigma prevents people from getting adequate care. It prevents us from believing people with substance use disorders about what they need. So stigma is a serious problem.
Alex, how can we as a community help combat addiction and the stigma around it?
Yeah, I think we like to focus our prevention and treatment and recovery on the individual and on the person who we think has the problem. But we can make community level, policy level, systemic, environmental changes that really make a difference. And one of the easiest ones to begin with is changing the way we talk about addiction, changing our language. So I frequently do language trainings to try to help people understand what language is harmful and what language is helpful. So that's low-hanging fruit, and it's a great place to start. So if you haven't had a chance to attend one of those trainings, you can look that up online, find that information. And then number two would just be educating ourselves about addiction. We're so much more prepared to help people in addiction and to prevent addiction and to do this work when we understand how it occurs.
Language really goes a long way in all aspects of life, but I can really see how it applies to this. Now, Alex, do we have resources at the Extension office if someone wants more information?
Absolutely. So what we're doing in Extension is we're trying to bring to bear all of the skills, all the gifts, all the talents that our specialists and our agents have in addiction, and to just direct those towards recovering audiences. So for instance, we have a finance expert. So we've created a curriculum called Recovering Your Finances. That's a financial curriculum specifically tailored for people in recovery to help them with unique challenges that they face. We're creating a nutrition program to pair with recovery centers. So truly the book is wide open, and I would encourage anyone in Extension to be thinking creatively about how their subject matter expertise can really apply to serve people in addiction recovery.
Well, Alex, thank you so much for being here today and for talking about such an important month. And recovery is possible, and we here at Extension are happy to help any way that we can.